All right, welcome back for the third and final part of our remote lecture, our last new material here in food systems and health. I do try to break these up because I find that listening to 45 straight minutes of this kind of lecture can be really exhausting. So hopefully this segmented format works for you. We're going to jump back in now and talk about restaurant food environments. Now, this is an important influence because we do see about half of all of our food spending in the United States going to restaurant food. Almost more than $500 billion spent on restaurant food here in the US on an annual basis, heading close to 2/3 of a trillion. And we do know that we have this really strong relationship, particularly between fast food and all kinds of negative health outcomes, obesity, high calorie diets, um, produce deficient diets, that sort of thing. Now, we know that's true for consumption, but we don't see really clear evidence in terms of living near fast food. It's an easy one to describe um, when we talk about the kinds of food products that fast food stores offer. But just the physical proximity of having your home near one doesn't seem to have that strong relationship that we'd expect from the outside. Now we do know that eating large amounts of fast food and even really any restaurant food can be a health hazard because whether it's fast food or not, any food that's prepared at a restaurant is likely to be higher in calories than an equivalent that you'd prepare at home. Also higher in fat, especially saturated fat, sodium, and cholesterol. An important thing to realize about fats and sodium and sugars is they're taste enhancers. They make food taste good. And if poor Red Robin, who we're picking on with our picture here, wants to get you into the restaurant, get you buying their product and coming back for more, taste is going to be a really important driver. Now, whether you're preparing your own dinner at your own kitchen table, you may not have that same motivation. You may have other kinds of drivers in mind, such as your health or your budget. But Red Robin or any kind of food retailer, their goal is to get you in, get you fed, and get you back to buy more. And they use the flavor enhancers of salt, fat, and sugar to do that. When we look at the kinds of interventions that we can manage in retail and restaurants, for retail, we know that in communities that are lacking full-service grocery stores, that the idea of using some kind of alternative financing or maybe a co-op structure, may not be able to convince Albertsons that they want to move a grocery store into a neighborhood where there isn't one, but maybe we could find just a different kind of financing structure that would make that work. We also see interventions that focus on healthy corner stores. New York City has a healthy bodega program that works with shop owners to make sure that they're getting regular deliveries of fresh produce, that they have a refrigeration for it when it gets there. If you don't have a cooler to keep, chicken breast in, doesn't really matter whether you can get it delivered or not. You're not going to be able to provide that to your customers. So it helps them work through all of the logistical challenges, and we do see higher consumption. Now we're not seeing long-term health outcomes from that yet because it's just a complicated thing to measure, and the programs really haven't been in place long enough to be able to see the kinds of to have the time to mature that we need to be able to assess those kinds of outcomes. And we also see efforts to bring farmers markets into communities. Even here in Las Vegas, we've had farmers markets start accepting EBT for SNAP recipients. Community gardens are another really important drive here. We've talked about those a couple of times here in class. And then produce trucks or produce carts. If we can't get people to the grocery stores, then we'll just bring the produce to the people. These are all ways that we can work on consumption patterns in these communities. What we don't really have yet is long-term evidence about whether or not these are going to help to move the needle on our important chronic disease epidemics. For restaurants, we've got this idea of healthy defaults. I believe we've talked about this before when we talk about, like, say, kids' drive-through meals. You know that McDonald's has the apples available for your kids' Happy Meal, but you have to take the time to order them separately. Healthy Default says, what if we just change that option so that when you come to the drive-thru and you ask for a Happy Meal, it comes with apples and you have to change your order for fries. An example of this, public health related, not really food systems, is signing up to be an organ donor. We know that in countries and societies where you opt in to be an organ donor, we tend to see participation rates that are definitely below 50%, perhaps closer to 30 or 40. If we change it around and you actually have to opt out of being an organ donor, then we see participation rates in excess of 80%, which really increases the pool of donated organs that are available for people who need that life-saving intervention. It's that same idea of changing the default option, uh, and it's a way that we can use that restaurant environment to improve consumption and drive the consumption of fruits and vegetables in particular. We've got some interesting evidence on menu labeling, posting the amount of calories in each item. In general, seems to drive people towards making healthier choices, but then we have a subpopulation that says, I'm here, I'm going to spend my $5 or my $8, and I want the biggest bang for my buck. So not a completely straightforward intervention, but one that does seem to provide some assistance. And then another policy-based tool that we've seen used in restaurant food environments is the idea of zoning code restrictions. There can only be so many fast food locations in this particular zone. We've seen that effort actually in California. Didn't actually see immediate outcomes in terms of health, but again, there's just maybe one that we need a longer time to see the results that we'd like to see. Okay, one specific element of community food environments that I want to take a minute to talk about is the idea of gardens. Obviously we had garden farms and Kira Byrne and Green Our Planet here, folks who are much more involved in the community gardening effort than me. But I wanted to take a minute to talk about the example of Denver that the textbook pulled out. We see that the Denver Urban Garden Initiative is now up to 125 gardens, and they're adding 15 a year. I think that Kira would probably laugh at that. They're growing much more quickly than that. But they do see that same relationship between garden involvement and increased fruit and vegetable consumption that Kira talked about among Clark County School District students. And I don't know if you remember the way that Tiffany from Garden Farms talked about the pleasure that people take in their gardens. And it's just healthy in so many ways that are not associated with diet, right? We've got the physical activity that comes with being outside and performing physical labor. And then just the sensory experience, and for some folks, the emotional and spiritual experience that can come with producing your own food. We know that we drive these cute gardens into school communities because we have that opportunity to affect kids when they're young, help to establish lifetime patterns. But it's not unique to them. If you have any time to ever had the chance to go to Vegas Roots or Community Garden here, we see community develop, even in places like Vegas that don't have our maybe the innate sense of community that more established towns do in other parts of the world or other parts of the country. We see community develop around the gardens, as Alyssa mentioned, even with our own community garden here at UNLV. So lots of ways that getting involved in a community gardening movement can benefit you beyond just the very straightforward health benefits of having fresh food and the budget benefits that go with growing your own. Okay, so let's talk about targeting that food environment. Our goal here with this knowledge is to improve the options that are available and the behavior change, help to drive behavior change so that we can improve chronic disease health outcomes, right? That's why we're here. We do know, as we mentioned at the beginning of class, that our environmental exposures do help to structure and determine our eating routines. If our routine is surrounded by fast food, it's going to be structured one way. So what can we do about providing a healthy environment so that we can help to structure those decisions differently? So what's one of our takeaways? We do know that we have this relationship between environment and choices. Not that it's completely determined, but it does provide the structure. And another important takeaway from our discussion here of food environment is that the way that the equity distribution in terms of the food environment is really an injustice. It really is an unequitable distribution of resources, and of course affects the communities that are most in need of support as opposed to the detrimental effect, and really does help to contribute to our problem with health disparities here in the United States. Um, if we're going to be looking at really helping people improve diet at the environmental level, knowing this is more effective than the individual level, we need to look at those structural factors, right? We can't come into a community, say you need to eat better, and walk away and expect that it's done. We want to avoid, blaming the victim, the people who live in these environments surrounded by these negative food influences. From a societal perspective, they're performing the way that they're expected to in the environment that they're given. So if we want to look at changing those factors, changing the outcomes, we need to address the influences that created them. And these can include both business and policy-based practices, right? Governmental effort here as well. Um, if we want to talk about really creating lasting change, we've got to work on these environmental influences. We talked about some examples of this in our last class when we talked about solutions. But one of the real beauties of this is that instead of asking individual people to do something that's very hard, if we can affect it at the environmental level, then we can make those changes easy and we can make them effective for a broader segment of the population. By using that approach, we tend to be more cost effective than trying to work with individual people to change behavior, and we can look at a broader and more successful intervention. All right, so in our online lecture today, we talked about what a food environment actually is, and then we talked about the role of equity here, how we tend to see a disproportionate burden, again, in terms of food environment that's borne by these same populations that tend to carry the burden for other kinds of health disparities as well. And then we looked specifically at food environment in homes, food environment in schools, some work that we can do in workplaces, and then the role of communities as well. So that'll wrap us up for our online lecture. I hope that you have had or are having a wonderful Thanksgiving, one of our favorite food holidays, and I'll look forward to seeing you next week when we return.